haven't heard by now, the American Cancer Society has announced new guidelines for cervical cancer screenings. The recommendations are that women aged 25 should start getting HPV testing every 5 years. Cervical cancer is the fourth most common cancer in women globally. It's caused by persistent infection from the HPV virus. Yes, a virus. So joining me now to talk about these new guidelines is Dr. Donna Adams-Pickett, a board-certified OBGYN. Thank you for joining us, Dr. Adams-Pickett.
Thank you for having me, Dr. Hilton.
Yeah, the American Cancer Society and the Health Resources and Services Administration recently announced these new guidelines. And the question is why? Why is there a change now?
Well, they really are basing a lot of these recommendations based on population and cost. And I'm glad that we're having the discussion because when we're talking about these guidelines, what the one line that everyone seems to miss is average risk. That these are guidelines that can be utilized for average risk individuals. Most of these guidelines involve spacing out your pap smears or even spacing out HPV testing. But that's only for average risk patients. And if you're African American living in the United States, we're not average risk for anything.
And what makes us high risk? Can you describe our subset of population?
Well, so let's talk about general high risk and then talk about how it can kind of apply to our community. So generally, we consider someone high risk if they started their sexual life, their sexual intercourse life at 16 or younger. If they've had 5 or more partners throughout their sexual life, and if they have had at least 3 abnormal pap smears in the past, and if they've ever had a sexually transmitted infection. And so any of those, just one, takes you out of the average risk category. So that's for everyone. Let's talk about our community. Many times we have not had access to healthcare. So to be able to truly determine if we have exposure to an STI, we may not have that access to determine that. To determine exactly, we don't have a lot of health education, sexual health education in our community. So a lot of times we don't realize that just having sex before the age of 16 can increase our risk. So those are things that takes us out of that average risk category. Also, the HPV vaccine is not highly utilized in our community, and that in itself takes us out of that average risk category.
You brought up the HPV vaccine.